Hi guys, this is Beulah with All Coast Home Health, and I'm coming to you from a private duty corner. And today I want to talk about signs that your loved one may need home care or private duty services. So I'm going to talk about two areas in particular. ADLs, which is activities of daily living, and IADLs, which is instrumental activities of daily living. So I'll start off talking about ADLs. ADLs involve areas such as bathing, dressing, toileting, feeding, and grooming. So you want to see in these areas if your loved one is showing that they are compromised and they're having difficulty with these type of activities. So when you visit, you may notice maybe they're wearing the same clothes over and over and not getting their clothes changed. You may also notice that they may be wearing less clothes, just maybe a t-shirt and sleep shorts, or just wearing a robe every time you visit. The other thing is you may notice that either they're not taking a shower or a bath like they used to, or they are not taking it at all. So you may notice certain odors, either body odors, or you may notice odors of urine. And looking at the clothing as well, is there increased stains on the clothing? It may be an indication, number one, is that the mobility is decreased and it's really difficult to get to the bathroom on time, to the toilet, so there may be some issues with that, so you may notice stains on the clothing. You may also notice stains, maybe if it's difficulty with feeding because there's the food is getting spilled on their shirts. And also, this is an indication if maybe there's some fine motor problems and therefore they're not wearing clothes with buttons or zippers because it's difficult to perform those type of activities. And now, instrumental activities of daily living. These are areas which include your cleaning, laundry, cooking, and one of the big areas that you may start noticing difficulties in the instrumental activities of daily living is when you visit, you notice that the mail is piling up. So they're not opening their mail or looking at the bills, and with the result, maybe there's issues such as electricity or water being cut off because of not addressing the finance area. The other thing is if you look in the fridge, you may notice that there's old food that is not thrown away, or there's maybe no food at all because shopping is being a really tough thing to do due to mobility issues. And laundry or dishes may start piling up, and there's a lot of disorganization in the home with increased clutter. And so these areas are big indicators that there may be a problem. Obviously, your loved one, it must be a change from what they typically do. If they've kept their home really tidy, or if they're always taken care of their physical self, and all these areas you're noticing that they're having difficulty with. The other area to also look at is maybe your loved one's having increased falls. And this is an indicator of various things. Are there increased balance issues, or maybe lower extremity strength difficulties, or is it due to maybe dizziness, maybe side effects of medications? So those are other indicators. You may also notice that medication bottles are laying around all over. This is an indication either they're forgetting where they're placing the medication bottles, or there's no organization anymore due to having difficulty with organizational skills, problem-solving activities. So I would say if you notice these, quite a few of these things, and they're having difficulty, that definitely and definitively that they are needing home care services, whether it's private duty or skilled home care, but it is definitely time to start looking for that. And at All Coast, we provide both of those services, and we provide it in a very skilled, professional, and compassionate way. And our management team is made up of physical therapist, occupational therapist, and an RN. And so we have a very holistic view of consulting and giving recommendations based on all these areas and all these skills that we have, with the physical therapy addressing mobility and having the skills in transfers, occupational therapist, such as myself, the activities of daily living areas, and the IADL areas, which are the instrumental activities of daily living, having that expertise to be able to consult with that, and our registered nurse with medical issues and with the ability to consult regarding medications and any other medical issues. So our team is really a highly skilled professional with many years of experience. I can't even count the number of years of experience between all three of us. And we also have experience in taking care of our loved ones and going through the process of knowing when to recommend certain services and being able to provide that feedback and be able to help our family members go through a process like this. So we are very understanding, extremely caring, and this we pass on to our staff when we're doing training with them and emphasize the importance of providing caring, compassionate care, but also having all those skills in training our staff in taking care of our clients in a highly skilled manner. So if you're looking for these services and think that maybe your loved one needs that, contact us at 352-751-1095, or you could go like us on Facebook or share these videos as well to others. We'll be doing a lot more videos which are educational and that can be used as resources when you have certain questions. And you could also go to our website, which is www.allcoastfl.com. Until next time, I will be sharing some more videos with some more educational stuff and resources that you could look at.